It's said that the eyes are windows to the soul, but what can they tell us about our health? A lot, according to researcher Dr. Carol Cheung of the Chinese University of Hong Kong. Her work is focused on finding out just what we can learn about ourselves with ocular imaging. She was on hand at APVRS 2023 to talk about the power of retinal imaging and why she reaches for Topcon's NW500 Fundus camera when it matters most.
So I'm Carol Cheung. I'm an associate professor in the Department of Ophthalmology and Visual Science, the Chinese University of Hong Kong. So image quality is the most important thing before we analyze the images. NW500 is amazing. First of all, everything is automatic. If the patient sits properly, I just press one button and then it can capture very beautiful images. And then secondly, we don't need to use eye drops to dilate the pupil. Before that, if we use eye drops to dilate pupil, we need to wait for like 20-30 minutes for that. But now we use our NW500. We don't need to wait for the eye dilation time. We are now doing community-based screening from elderly patients. They are not happy with using drops to dilate their eyes, and there's also a risk for angle closure glaucoma for some elderly people. So, using this NW500 machines, we are very easy to capture good quality images from elderly people. NW500 actually allow us to image the retinal photographs from very small people. For example, it can go to down to 2 millimeter pupil size. It still can allow us to capture very good retinal fundus photograph. So a lot of retinal disease can be diagnosed and identified by a retinal camera. So for example, age-related macular degeneration, features of diabetic retinopathy, also Drusen, ERM, there's lots of retinal. Disease can be identified. One of my research interests is to use retinal fundus images as a model to study brain disease, for example, Alzheimer's disease, because retina is very special organ that we can actually capture the retinal vessels and also the optic nerve from retinal photographs. We analyze the features from the retinal fundus photograph that can allow us to capture the features related to Alzheimer's disease and allow them to estimate the probability of having Alzheimer's disease. So actually we have done a small study to compare the image quality between a conventional retinal camera with NW500. We found that the gradability is very high, up to 100%. Comparing to the conventional retinal camera, the gradability is about 70 to 80% only in a group of old people. I think there are several ways that can help. First, the image quality is good because before that, sometimes ungradable images always refer to ophthalmologists to see. In fact, actually, it's just the image quality issue. But with NW500, we know that that can reduce the ungradable images to refer to ophthalmologists in terms of screening. And second, it can allow us to clearly see what kind of abnormalities from retinal fundus photograph that can be directly, if there are really real eye diseases, for example, diabetic macular edema, diabetic retinopathy, we can just refer to ophthalmologists straightforward. The design and then the interface is very easy to operate because it's very straightforward. We train nurses, research assistant, technician to use. They are very happy with NW500 and keep saying that this is a very good retinal camera. I highly recommend NW500 to everyone. So I've been using retinal camera for more than 10 years. This is a really beautiful retinal camera without any pupil using drops for eye dilation. You can obtain a very good quality retinal fundus images. I highly recommend for people to use it.
Dr. Carol Cheung thinks that retinal imaging can paint a critically detailed picture of a patient's health, and she relies on the NW500 Fundus camera for the task. To learn about what the NW500 can do for you, no matter what you practice, connect with Topcon Healthcare today.